Tomorrow is an historic moment in the fight against the COVID-19 pandemic here in South Africa. The plane carrying South Africa's first batch of vaccines has left India and is expected in the country tomorrow. Health Minister Serum says 1 million doses will be arriving from the Serum Institute of India. eNCA's Slindelo Masikane is tracking the vaccine developments, and she joins us now.
Well, the big question is, of course, when is this shipment expected to arrive? The countdown has officially begun. The first batch of the AstraZeneca vaccine is coming from the Serum Institute of India. We know that the first 1 million doses has actually already left Mumbai in India, and the plane is expected to fly via Dubai and land at the O.R. Tambo International Airport on Monday. Now, let's just take a listen to what one of the journalists in Mumbai is saying regarding the cargo.
The vaccine has left the Indian shores. I think it has left Mumbai, and the dosage, I understand what I read from even tweets in South Africa, is some 1 million doses. This is the commercial supply which Government of India has permitted AstraZeneca, because it's in fact over the last few days, Government of India has been releasing consignments to various countries on commercial basis who are agreeing to an arrangement with AstraZeneca. These included countries like Brazil, Morocco, and Bangladesh. And of course, further supplies were also cleared for South Africa, Saudi Arabia, Canada, and Mongolia. So this is how the commercial supplies are also being rolled out. And this is alongside the vaccination program that's going on in India.
So let's take a look at what happens after the vaccines arrive. The vaccines will be undergoing some technical processes, we understand. These involve quarantine as well as quality assurance and reconciliation. This process is expected to take around 10 to 14 days. Let's have a listen to what the Health Minister had to say earlier this week.
After the arrival of the vaccine, they will undergo some technical processes of quarantine, which is specified in the law, quality assurance, reconciliation, how many vials are there, how many are broken, how many needs to be returned back, and all of those issues. These are all necessary for the safe distribution of the vaccine. These processes will take a minimum of 10 days and a maximum of 14 days to complete, upon which we will then be ready to distribute the vaccines to all the provinces.
Now, let's take a look at actually how this vaccination process will be rolled out throughout the country. Now, when enough people are vaccinated, we will reach what is known as herd immunity or population immunity. While the actual level needed for herd immunity is not actually known at this stage, our scientists estimate that we will likely reach immunity around 67% of our population is immune. So this amounts to around 40 million people in South Africa who need to be vaccinated. So apart from the procurement coming from India, let's take a look at exactly where our government is getting the vaccines. We know that they are engaging with the World Health Organization's COVAX facility, as well as the African Union's vaccine initiative, as well as direct engagements, we understand, with vaccine manufacturers like AstraZeneca. Now, the vaccines will be rolled out in 3 phases. Government has identified priority groups that need to be vaccinated, as well as receive the vaccine doses throughout the year. First on the list are those on the front lines, of course. Those are healthcare professionals. Let's just take a listen to what they had to say in terms of what they are feeling about taking the first jabs.
It's a very mixed feeling that we get, very mixed messages. Some people are cross and say, why is SAMA, endorsing the AstraZeneca for healthcare workers? Why are we not waiting for the Pfizer? But it's not something that SAMA can do something about. This is what is going to come into the country. You either take it or you leave it and take your chance with the vaccine. And if you don't vaccinate with the virus, and if you don't vaccinate, no, it's not to say that you will be eligible to get the Pfizer one coming in later, because as I have said, that is going to be a more difficult vaccine to roll out in terms of logistics. It's actually going to be extremely difficult. We cannot afford to lose any more healthcare workers dying on COVID-19.
Now, we know that in phase 2, when more of the vaccines arrive, essential workers such as teachers, police officers, municipal workers, as well as other frontline personnel will be prioritized. In phase 3, with increased manufacturer supplies, government will then vaccinate the remaining adult population of about 22.5 million people. Now, people also need to remember that vaccination is voluntary. No one can be forced to take the vaccination. Now, how will these vaccinations be administered? Let's take a look. Government has established a national coordinating committee that will be assisting with the rollout of these vaccinations. They will be taking place throughout hospitals, clinics, outreach services and mobile clinics, as well as private settings such as doctors' offices, as well as pharmacies and workplaces. Now, we also know that organized labor, such as traditional leaders, as well as the religious community, will be playing a vital role in the dissemination of accurate information on vaccines and ensuring that optimal participation is required. We know that while acquiring the vaccine has been a challenge, another hurdle is actually going to convince people to actually participate and get their jabs.
Thank you very much for that thorough work through of how the rollout is going to work, Slindelo Masikane.